If you're over 50, there's one brutal truth you need to know.
Your first heart attack might also be your last, unless you know exactly what to do in the first 3 minutes.
I'm Dr. Hart. I've spent more than 20 years in emergency medicine, treating thousands of cardiac emergencies.
What I'm about to share with you isn't theory. It's what I've seen work in real life.
Every step I will show you today has been proven by science, and it can mean the difference between life and death.
Almost half of all heart attack victims die before they ever reach the hospital. Why? Because they wait. They second guess. They panic. And the heart, listen well, doesn't forgive hesitation.
So in this video, I will walk you through 7 simple, evidence-based actions you can take.
If a heart attack strikes when you're completely alone, I truly hope you will never need them, but if you do, they might just save your life.
Let's start with the very first and most important step.
Step 7. Call emergency services immediately. The very first action that decides whether you live or die is not a pill, not a position, not even your breathing. It's a phone call. The moment you feel crushing pressure in your chest, sudden shortness of breath, nausea, or that strange cold sweat, call emergency services immediately. Don't wait. Don't hope it will pass. Don't tell yourself it's just gas or stress. Because every minute you hesitate, your heart muscle is dying. And once those cells are gone, they never come back. Cardiologists have a saying, time is muscle. For every minute blood flow is blocked, more heart tissue dies. After 10 minutes, irreversible damage begins. After 30, entire sections of your heart can fail. That's why calling for help instantly, not after you make sure it's serious, is the single most important action you can take. According to the American Heart Association, people who contact emergency services within the first 10 minutes of symptoms are up to 50% more likely to survive. But tragically, nearly 1 in 3 seniors waits longer than 2 hours before doing it. Why? Because they don't want to bother anyone. They think they can handle it. That hesitation kills. I once treated a man in his late 60s, strong, independent, retired firefighter. He felt a heavy pressure in his chest while mowing the lawn. He sat down, drank some water, and told himself it was nothing. When his wife found him an hour later, he was barely conscious. He died on the way to the hospital. The paramedics told me, if he had called the moment it started, he almost certainly would have lived. The brutal truth is this: you don't lose the fight against a heart attack in the hospital. You lose it at home, in those first few minutes when you choose to wait. So the next time you feel chest pressure, breathlessness, or unexplained pain, act as if it's a heart attack until proven otherwise. Pick up the phone and call emergency services right away. Even if it turns out to be nothing, you lose nothing. But if it is a heart attack, that single call could be the reason you're alive tomorrow. Remember this: hesitation kills, action saves. Step 6. Chew an aspirin, if available and not allergic. Once you've called emergency services, the next step can literally decide whether your heart keeps beating or not. If you have aspirin at home, chew one immediately. Don't swallow it whole. Chew it. Because aspirin isn't just a painkiller. It's one of the most powerful, life-saving, clot-fighting drugs you can buy without a prescription. Here's what happens during a heart attack. A blood clot forms inside your coronary artery, blocking blood flow to your heart muscle. Every heartbeat after that is like trying to run an engine with no oil. The friction destroys it. Aspirin works by thinning the blood and preventing the clot from growing larger, keeping some flow moving until paramedics arrive. A landmark study in The Lancet found that taking aspirin during a heart attack reduces the risk of death by 23%. But the key is speed. The faster you take it, the better your chances. Swallowing it whole can take up to 10 minutes to start working. Chewing it breaks it apart instantly, allowing the active ingredient to absorb through your mouth and stomach lining within just 2 minutes. I'll never forget one patient, a 70-year-old bus driver who felt that crushing chest pressure while watching TV. He remembered his doctor's words, "Keep aspirin nearby, it might save your life." He grabbed the bottle, chewed one tablet, and called emergency services. When he arrived at the hospital, we ran the tests. Yes, he'd had a heart attack, but the damage was minimal. His quick action had kept enough blood flowing for his heart to survive. Now, if you're allergic to aspirin, have a bleeding disorder, or your doctor has told you not to take it, skip this step. But for everyone else over 50, keeping uncoated aspirin in an easy-to-reach place is one of the smartest safety habits you can have. Doctors usually recommend one full tablet, 325 milligrams, chewed at the first sign of a heart attack. Think of that small white pill as a rescue team, slowing down the disaster until reinforcements arrive. Aspirin won't cure the attack, but it can stop it from turning into a death sentence. Don't underestimate that one simple step. Step 5. Loosen tight clothing and sit upright. Your position and your clothing might not seem like a big deal during a heart attack, but they can actually change how much strain your heart is under. When blood flow is already limited, even a tight belt or collar can make it harder for your body to circulate oxygen. So if you ever feel chest pressure, loosen anything around your waist, chest, or neck and sit upright. Why upright? Because lying flat forces your heart and lungs to work harder. When you sit upright, with your back supported and shoulders relaxed, you open your lungs, reduce pressure inside your chest, and make breathing easier. That means your struggling heart doesn't have to fight against your own body just to keep you alive. I remember a 74-year-old woman in Florida who started feeling chest pain while gardening. Instead of lying down in panic, she moved to a chair, loosened her apron and waistband, and sat upright while waiting for the ambulance. Her doctor later told her that simple decision likely prevented her from collapsing before help arrived. Sometimes, survival comes down to something as small as how you position yourself in those first few minutes. Physiology backs this up. When you sit upright, your diaphragm can move freely, letting more oxygen into your lungs. That oxygen-rich blood goes straight to your heart and brain, the two organs that need it most right now. Lying down compresses your chest cavity and traps fluid in the lungs, which makes the feeling of suffocation even worse. So, here's what to remember. Sit down on a sturdy chair or the floor with your back supported. Keep your knees slightly bent. Relax your shoulders and neck. Loosen anything tight around your chest or stomach. These small adjustments reduce the workload on your heart and buy you precious time until help arrives. Think of it this way. When your heart is fighting for every beat, your job is to make that fight as easy as possible. Give it room to breathe. Step 4. Cough strongly if you feel faint. Cough CPR. This next step sounds strange, but in the right moment, it can keep you conscious long enough to survive. If you feel dizzy, lightheaded, or like you're about to pass out during a heart attack, start coughing. Yes, coughing. Hard, deep, controlled coughs every 2 to 3 seconds. Doctors call it cough CPR. When you cough forcefully, your chest muscles contract and pressure builds inside your chest cavity. That pressure forces a burst of blood out of your heart and toward your brain, just enough to keep oxygen flowing when your circulation starts to collapse. You're basically giving your heart a manual push to keep it going. Now let's be clear. Cough CPR is not a cure. It won't stop a heart attack, but it can buy you precious seconds. And those seconds might be the reason paramedics find you alive. In one study published in the Journal of the American College of Cardiology, patients who performed strong, repeated coughs during cardiac arrhythmia were able to stay conscious until treatment began. In some cases, their blood pressure stayed stable for several minutes, just from that physical action alone. Imagine a man in his late 60s, alone in his workshop. He feels sudden dizziness. The world starts to fade. He remembers hearing about cough CPR and starts coughing. Hard, deep, rhythmic. Every cough acts like a heartbeat, keeping blood moving just long enough for the ambulance to arrive. That simple reflex can mean the difference between losing consciousness and staying alive. Here's how to do it properly. Take a deep breath, then cough hard from your chest, as if you're trying to clear your lungs. Repeat that every 2 to 3 seconds until the dizziness fades or help arrives. You're using your own body to keep blood flowing when your heart can't. It's not perfect, it's not guaranteed, but it's one more way to fight back when every second counts. Remember, cough only if you're feeling faint or losing consciousness, not as a routine action. The goal is to stay awake and breathing until professionals take over. Step 2. Take slow, deep breaths. When a heart attack strikes, panic is your worst enemy. The moment fear takes over, your body floods with adrenaline, your heart rate spikes, your blood pressure rises, and your struggling heart has to fight even harder to survive. That's why the next step is simple but powerful. Take slow, deep breaths. Controlled breathing helps in 2 vital ways. First, it increases the amount of oxygen reaching your blood and brain, oxygen that your body desperately needs right now. Second, it signals your nervous system to calm down, lowering stress hormones and easing the strain on your heart. In a study published in the Journal of Cardiopulmonary Rehabilitation and Prevention, patients who practiced slow, diaphragmatic breathing during cardiac stress experienced lower heart rates and improved oxygen flow. In plain terms, deep breathing gives your body a fighting chance. Let me share a story. A 76-year-old retired nurse from Michigan once told me how she survived her heart attack. She felt that crushing pain, the cold sweat, the dizziness. But instead of panicking, she focused only on her breathing. She sat upright, placed a hand on her stomach, inhaled slowly through her nose, and exhaled through her mouth as if blowing through a straw. By the time paramedics arrived, she was weak but conscious. Her cardiologist later confirmed those calm, steady breaths likely reduced the workload on her heart and kept oxygen flowing to her brain long enough for treatment to begin. Here's exactly how to do it if it ever happens to you. Place one hand on your stomach, not your chest. Inhale deeply through your nose, feeling your belly rise. Exhale slowly through pursed lips, as if blowing through a straw. Keep your breathing smooth and steady, about 6 to 8 breaths per minute. This kind of breathing doesn't just help your body, it helps your mind. It gives you something to focus on, something to control, when everything else feels out of control. Think of every breath as a countdown. Each inhale and exhale buys you another moment of life, another second closer to help. Don't rush. Don't panic. Just breathe. Step 3. Unlock your door and keep your phone nearby. This step might sound simple, but it can be the difference between being rescued in time or being found too late. If you're having a heart attack and you're alone, unlock your door immediately. Then, keep your phone right next to you. Here's why this matters. Paramedics are trained to break down doors if they have to, but that takes time. And during a heart attack, time is life. Every 10 minutes of delay reduces survival chances by nearly 10%. Don't let those precious minutes slip away because help can't reach you. I remember a 73-year-old widower in Arizona who did everything right, except this one thing. He called emergency services but collapsed before he could unlock his front door. Paramedics arrived within minutes, but they had to break through the door. Those lost seconds cost him his life. Now imagine the opposite. An 80-year-old woman in Florida felt that same chest pressure. She unlocked her door, grabbed her phone, and sat near the entrance while waiting for help. The paramedics reached her within moments. No barriers, no wasted time, and she survived with minimal heart damage. Sometimes, survival isn't about medicine. It's about preparation. Your phone is just as critical. Keep it beside you at all times. Not in another room, not on a charger across the table. Because if you have to stand up and walk during a heart attack, you might not make it far. Staying close to your phone means you can keep talking to emergency responders, follow their instructions, and stay conscious until they arrive. If you can, put your phone on speaker mode. That way, your hands are free, and you can keep breathing slowly without worrying about holding it to your ear. So remember, unlock your door, sit nearby, and keep your phone close. Your phone is your lifeline. Your unlocked door is the bridge that gets help to you faster. Together, they can buy you time. And in a heart attack, time is everything. Step 1. Stay as calm and still as possible. When a heart attack strikes, your first instinct might be to move, to walk it off, to grab something, to do anything to stop the pain. But that instinct can kill you. The number one rule for survival is this: stay as calm and still as possible. Here's why. Every movement, every step, forces your damaged heart to pump harder. And during a heart attack, your heart is already fighting for its life. The more you move, the more oxygen your heart demands. But the blood flow that delivers that oxygen is already blocked. It's like asking a broken engine to run faster. Eventually, it just stops. A study in the European Heart Journal found that patients who minimized physical movement during acute coronary episodes had significantly better outcomes than those who tried to stay active. In simple terms, the calmer you are, the higher your chances of survival. Let me give you a real example. A 71-year-old farmer in Nebraska was repairing his tractor when he suddenly felt that crushing chest pain. His first thought was to climb up the ladder and grab his phone, but he stopped himself. Instead, he sat down right where he was and called for help using his smartwatch. When paramedics arrived, they told him that staying still had likely prevented his heart from collapsing under stress. He walked out of the hospital 2 weeks later, alive. Calmness isn't just about your body, it's about your mind. Panic releases a surge of adrenaline that spikes your heart rate and blood pressure, worsening the attack. By focusing on stillness and deep breathing, you slow down that hormonal storm and give your heart the chance to survive. So, if this moment ever comes, tell yourself, I've called for help. My only job now is to stay still and breathe. Don't try to walk to the door. Don't reach for something across the room. Sit down, breathe slowly, and stay calm. Think of your heart like a fragile engine running on fumes. Every movement revs it up and risks blowing it apart. Stillness keeps the engine alive until help arrives. Do less, breathe more, and let help reach you.